Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I am very, very pleased to welcome TEKEM HERMINE Nadege out of Cameroon. And Tekem is a nurse with over 6 years' experience in mental health. And she says she specializes in compassionate care and support in liaison psychiatric hospital setting. She is a certified MHGAP trainer, and she'll tell us all about that, and a psychological first aid provider. And she says she's committed to equipping professionals and communities with essential mental health skills. So welcome, 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 Tekem.
Thank you very much. It's an honor to be on this platform.
It is my pleasure. It is really my great pleasure to have you. But first of all, I always want to know from nurses why they're nurses. So what brought you to nursing?
Um, Primarily, my inspiration stemmed from witnessing my father being sick throughout my childhood. My father is currently affected with a neuropathy. And as a child, before the age of 7, for me, I was very happy to be able to read on a medication bag and know I have to serve his drug 7 a.m., 7 p.m. And I did that so perfectly, instilling his high medication, serving his drugs. And before my adolescence, I started taking him to the hospital for physiotherapy and things like that. So at the level of the hospital, I was so amazed. Nurses were so patient to carry him, and he's complaining, he's never satisfied. The nurses were so patient, so caring, so nice, and they would do everything to cheer him up because he was unable to walk. He had some impairment.
Mm-hmm.
And by then, I was so amazed by the pristine whites of nurses' color, their dress. Today, I really wonder if it is still white the way I perceive it at that period. But
Mm-hmm.
that white, to me, it was really inspiring. I really thought I need to belong to this profession. And I kept doing that, I mean, throughout my adolescence and my secondary school. And thirdly, I was surrounded by my models who happens to be my aunts. They were good nurses. People recommended them. The way the community look at them, like they will just come, doctor, I have this. They don't even care if you're a doctor or you're a nurse, but they just
Mm-hmm.
come to you. They respect you so much in the community. It started ringing the bell in my mind, and I said, this is what I'm going to do. And when I had the opportunity, I grabbed it and I said, I'm going to be a nurse, and I'm a nurse today.
That is really cool. That's really cool because, a lot of people come with to nursing and they had other ideas of what they might like to do and eventually narrow it down to nursing. You know, had you had contact with the healthcare system from a very early age, and it drew you in. So looking at it, you had contact as a consumer, but looking at it as your perception as a consumer, and then when you got there to be the practitioner, what was it? What you thought it would be?
Um, Initially, I was a little bit shocked. Like, I was shocked actually to see that as a consumer, your perception is different. You just see that
Mhm,
smiling part of the nurse, that gentleness. But when you get there as the professional, you start facing some kind of maybe, let me say, malpractice or judgmental
mhm, mhm,
behavior towards patients. Sometimes, like somebody is not just totally devoted to the patient; she's just doing it to gain
mhm,
her weight at the end of the month. So there was that shock, but rapidly after, I'm fortunate. I'm so proud of my institution. I work for the Cameroon Baptist Convention. So they are Baptists, and I believe we really do much of that compassionate care. Like our mission is to render compassionate care all the time. And there, at least there's a lot of supervision. They keep training you. They make sure you offer that quality care. Of course, there will always be some people who draw you back, but I believe belonging to a system like this really made me to continue to see what I saw and what attracted me in the field of nursing.
So you very strongly just now talked about the commitment of your institution to fostering compassionate care, which is like huge from my perspective, because very often, institutions become big and kind of overburdened, and you find that the institution itself functions. You feel the institutionality of it, but in your case you're feeling the compassion of that institution as well as everything else, which to me is huge.
Huge. It's something I really value. Although with time, the hospital is growing bigger and we are getting people from different horizons, different cultures and stuff, we still face these challenges. But the moment they come into the system and they find everybody is doing the right thing, I just think they have to toe the line and I mean, continue. All of us, we are doing what we have to do all the time.
Yeah, I love it. I love it. I love it. So you have chosen mental health as a specialty. Was that the only area in which you worked?
Um, no, before choosing mental health as a specialty, I've been a ward nurse. I've worked in the maternity, doing with
Mm-hmm,
labor and delivery,
mm-hmm,
postpartum,
mm-hmm.
neonatal care. I've done that for 2 years. Even medical and surgical wards, I've done that for 2 years. But because of the pressure of the work, I started wondering if I could just stay focused on one thing, because working in the wards, like maybe this month you are in children's ward, next month you are in a
Mm-hmm.
surgical ward, today they send you back to the maternity. I just thought switching on and off, it doesn't like build,
Yeah.
doesn't build me enough to be effective. So I started thinking, what can I do? Then I had some colleagues, some senior colleagues who did mental health training. So when they came back, I was amazed to realize that persons with mental illness could gain full remission. Because in our context here, mental health is very highly stigmatized, even is
Mm-hmm.
mystified. We believe in demons, they believe in curses and stuff like that. So at that level, as a nurse, although we had a course in mental health, I never realized that somebody with mental illness could recover. So when I saw my senior colleagues doing that, it was to me like transforming people's life, giving them a second chance to enjoy fully. And at that moment, I knew this is what I want to do. And fortunately, I had a scholarship. I was sent to Nigeria in the Federal Neuropsychiatric Hospital, where I was trained for 2 years. So that's how I got into mental health. And till today, I will never regret my choice. I don't even know if I can do something different from mental health. I'm not sure. I'm not sure.
That is awesome. That is awesome. That is awesome. And as I read your bio, you talked about um being a gap action trainer and mental health gap action trainer. Tell me about that a little bit.
So, a mental health gap action trainer is somebody who has received the training. Generally, it's a 2 week intense training. You have done it over and over. You've done the refresher, and you're certified to train other people. At the primarily mental health gap action is we call it MHGAP. It is a
Mm.
manual. This manual was produced in order to reduce the gap, because if we say one psychiatrist to 100,000 patients, okay, in Cameroon, we barely have 10 psychiatrists. So the idea was to reduce this gap so that the resources will be accessible and people will be able at least to get minimum services when they need it. So with the mental health action plan, we train persons who are healthcare provider but not specialized in healthcare, such as medical doctors, nurses, sometimes social workers. We give them this training. We supervise and we do refreshers to make sure that at least they're able to know the basic or the warning signs of mental illness. They can identify, they can give basic psychosocial support to people who need the services. They can refer cases that they cannot take care of. And they can follow up patients who have been maybe to see a specialist and they are not maybe able to leave maybe their local community to come right up here. They can continue their follow-up to see that they are taking their medication. They can even help as a liaison person collecting their medication and making sure they stay compliant. So it's a whole lot, the mental health action program. So, I mean, like as of now, we have trained, I can say more than 200 persons. Yes, we have trained doctors, nurses, more than 200 in the system and out of the system. When I say in the system, like in the CBC Health Board, the Cameroon Baptist Convention Health Board, and in the public setting, staff from the public setting.
Yeah. Awesome. And that is like I don't even know how to. I'm trying to wrap my mind now around this because as you tell me, it's a 2-week intensive training, and I'm thinking that for someone who for whom mental health education was a little bit of something that they passed through during their own education. An intensive training like that is really intensive.
Yes, it's very
Really
intensive.
Yeah.
So what makes us now to really be sure they can deliver once on the field is the supervision. Regular supervision, and the refresher. Now to link patients that you cannot care for them to the appropriate quarters. That's what really makes it somehow effective.
So you said that this was a manual. How was this manual developed? Who developed this manual?
The manual is developed by the WHO. Yes, the manual is developed by the WHO. And now every system, if you want to acquire it, is online. You can download it online and then you use it.
So that is that this is available in all countries to all people. That's awesome. That's awesome.
Yeah.
That's awesome. Now, you also describe yourself also as a psychological first aid provider.
Yes,
That's a new term for me.
It is.
How would you describe that?
I can say psychological first aid primarily is this emotional support, this first-hand support. Just the first way we do first aid. Let's think about first aid.
Right.
First aid you give to somebody maybe who's choking or that in physical health is easy to understand.
Yes.
Psychological first aid is the same concept, but now it's different. What are you bringing? You're bringing emotional support to somebody who have experienced a traumatic situation. And now you don't want that traumatic situation to escalate into something else. So you come in at that moment, you give him psychosocial support. You try to see what you can do to reduce the intensity of the trauma so that the person can quickly be resilient and go back to his normal functioning. So psychosocial support, one moment I really was impressed by the impact of psychosocial support was during response activities towards COVID-19. Yes, that's really the moment I really saw the effectiveness and the impact of psychosocial first aid, psychological first aid, sorry. So just like identifying everybody with a positive result, identifying their worries, their stress, and normalizing them at that period and reminding them that they are not alone, you're there, you can always support, just with information, nothing more, sometimes just information, resources available. You really allay a person's anxiety and you see them cope well with the disorder. So that's one of the moments I personally can testify psychosocial, psychological first aid works like magic. It was so amazing to me.
As you speak to me, and I'm sitting here listening to you, and I can almost feel your passion coming through.
Yeah.
Let's shift a little bit. In Cameroon, what do you think you'd like to see, if anything, change about nursing in Cameroon?
Well, I told you that I don't know anything out of mental health. So to me, the first thing, if they should be changed, if I could have power, if my voice was really like counting at the moment, I would
Yes.
like great emphasis on mental health support for nurses.
Mm-hmm.
Nurses go a lot, but sometimes the support is not there. There is a lot of self-sacrifice, putting their mental health right behind there. And at the end of the day, they are drained.
Yeah.
So if they could like implement some more robust mental health resources and prioritizing mental health among healthcare workers, it would just be perfect. To me, that's just like for nurses to know that if I'm stressed, let me just move to the social worker. If I'm stressed up, let me just move to the mental health nurse. If I'm stressed up, what can I do? Those resources should be there for nurses. To me, that's something that will really not only improve their resilience, but their productivity, their overall well-being.
Yeah. Understood. Here's the thing. You had again, you have wanted to be a nurse. You were laser focused on being a nurse. But many people are not so much. They vacillate a little bit. Do I want this? Do I want that? What advice would you give to somebody who's thinking about it, about becoming a nurse? What would you tell them?
To somebody, I have like persons come to me most of the time, like trying to really see if their passion is into nursing. But I always tell people, be sure you're not coming to nursing, you're looking for money. You're coming to nursing because you love caring for people. If you're looking for money, don't come into nursing. Like in our context, of course, yes. And if nursing is something, you need to be ready for it.
Yeah.
You need to be ready. There are things if you have not done before coming into nurses, you are never going to be able to do it again. So I tell them, nursing is beautiful. Being able to restore somebody's health, being able to see the smile and the love that you can give through your services is just so fulfilling. Even if the money is not there, going home knowing that I made somebody smile, I think it's just enough sometimes. It makes you feel good about yourself.
Yeah.
Yes.
Yeah. So I have been asking, I've been asking people, if you could tell me in just one word what you see as the most essential quality of a nurse, what would that word be?
Sorry, come again.
I said, if you could tell me in just one word what you think of as the most essential quality of a nurse, what would that word be?
One word. Let me just
You
give
can
two.
give me two.
I'll talk first of self-sacrifice. But when I
Okay.
talk of self-sacrifice, it's a virtue for all healthcare providers. It's a virtue. But again, if you want to care for people, if you want to render effective care all the time, you must take some time, step back, and take care of yourself. Because self-sacrifice is not the name of the game. You must remember you're a human being. You need to preserve your physical and your mental health. Now, when you can align all these things, the greatest challenge is about being a warrior, saving life, and saving your sanity. That's what I think about self-sacrifice. Then being able to show compassion. Sometimes you don't even know what to do, but just showing compassion.
I know.
So those two things to me are really a must for a nurse. If you cannot sacrifice, you cannot work maybe some few extra hours, or you cannot place yourself in the shoes of another person, you cannot be empathetic, you cannot be compassionate, you're not ready. You're not ready at all.
Yes. Yes. So, in answering that question, you just touched on something that I was about to ask afterwards. And that is, you talked about caring for yourself. So, which is extremely important, as you just said. So, what do you do to care for you?
People don't respect my working hours. Terrible. Okay. To me, when you talk about self-care, I think the whole of this week I've been talking about self-care to staff, because as a private institution, we really work. It's a joke. And most of the time we forget about ourselves. And to me, I perceive self-care as a vital practice of nurturing your physical and your mental well-being, even your emotional.
TEKEM? Ah, for some reason it's frozen. Oh dear. Let's just wait for a bit. Okay, I'll pause the record. Oh, okay. I lost her. Okay, so TEKEM, as I was saying, you touched on self-care when you answered my previous question. So, what do you do to take care of you?
So to me, I first perceive the self-care as a gift to myself. After taking care of others, family, patients, sometimes you have to take some time off to think about yourself, to take care of yourself. So there are so many activities I can think of when it comes to self-care. So the first thing is just maybe enjoying a good laughter, laughing with friends and colleagues, enjoying some good moment, or hanging out with friends, doing something that is totally different from work. Any activity that helps me disconnect. I'm not in a meeting. I'm not on TikTok. I'm not talking about work. I just want to be disconnected totally from work. So, but what I do is enjoying good moment with friends, especially when it involves laughing. To me, it's very important. It really makes me feel like all the tension in my head is being relieved. I also enjoy traveling. It really helps. It's very therapeutic to me. People
Yes.
see tiredness in traveling, but to me, the moment the car is going, I'm so comfortable. So traveling, just changing environment is another way. I equally enjoy taking care of myself, like looking good, being beautiful, doing my hair, doing my nails, just giving my hands to somebody, let him take care of me. Okay, just go with, normally we buy all these things, we have them at home, but sometimes you need somebody to really give you a good shampoo, massage your hair, relax all the time. Yes. So self-care, to me, everybody's journey to self-care can be unique and different,
It is.
but I really prioritize the moment someone else is taking care of me, and which is not work, which is not like, yeah, there's something different. And of course, family, sometime being with family, sharing some memories and things like that, it really contributes to my healthcare. And of course, things like eating well, prioritizing your sleep, drinking, like being moderate about drinking. There are
Yeah.
things I really observe to be sure that I'm preserving myself and I'm taking good care of myself.
Yeah, yeah, absolutely important. Absolutely important. Tekem, this has been a great conversation. I have really appreciated talking to you. Is there any last words you'd like to leave us with before we go?
If I should say something, I would just encourage more persons to involve in mental health. Each time they talk about mental health, people just perceive the crazy nature of it. Somebody who's poorly dressed, somebody who's speaking things that are not connected. But they omit to look beyond there's well-being. Why do you want to just limit it to illness? There is well-being also in mental health. So I really want to encourage persons, nurses, healthcare provider to pay some attention to mental health, because it's not only beneficial to your patients, it helps me also to be resilient, to cope with other stressors of life, to help my family. Since I started this profession, I have identified so many persons in my family that needed mental health services, and they have been running shelter-skelter, going from one prophet to the other and being duped by people. So to me, if I will encourage somebody doing a specialty, it should be mental health. Mental health is beautiful. Mental health is everything. So that's what I can do. I encourage more people to join the call and to forget about the negative aspect and the stigma that is associated to
Yeah,
mental health.
yeah,
Many
yeah.
people are going through stress, they're going through challenges. Many people really need these services. So if anybody is watching and he's thinking of specializing, please do join mental health call. Thank you very much.
You are the ultimate spokesperson for that. But I have to say before I go though, that you just said something that I thought was very important. You said that very often people are going from place to place looking for help. And I think that very often they don't even realize that the help they need, they're looking for the wrong kind of help. The help they need is mental. And very often we don't
Exactly.
realize when things manifest themselves, and sometimes it manifests physically, and we don't realize that the root of that is not really even a physical thing.
Not at all. Not at all. And in this part of the world, is still, well, although I've realized the awareness needs to go around anyway, but here we are still really struggling to destigmatize mental health and mental illness. Even among healthcare providers, we're still struggling. Before the community, it is
Yeah,
difficult.
yeah.
So that's why when people get sick, here in our context, the first routine, the first therapeutic itinerary, they go to prophet, they go to soothsayer, they go
Mhm.
to traditional practitioners. And most of the time they waste all the money. And when they are coming here, they are ruined. There's no way forward. So
Yeah,
it's really, really challenging.
yeah. I fully understand that. And the stigma towards mental health, I have to tell you, is pretty much worldwide.
All
Pretty
right.
much worldwide. Maybe it is more in some places than others, but there is still a lot of stigma towards mental health. But anyway, take them.
And it's one of the
Go. No, tell me.
I, yeah, I was saying that the stigma is one of the barriers, because when we talk of stigma, we just perceive the community, but even the healthcare provider do stigmatize persons with mental illness, and it's
Yeah,
one of the major barriers for persons seeking help. Why
yeah,
will I go for help if people will look me, they will
yeah,
reject me, they will. I mean, so it makes it difficult. People can stay more than 2, 3 years before making up their mind to go to hospital. So the stigma is one of the major barriers. If we could remove stigma, people will feel confident. People will
yeah,
feel free to come to hospital.
yeah,
I feel like I'm depressed. I feel like I'm losing it. I feel like this. I feel like
yeah,
that.
yeah.
Mhm.
And we can escape a lot of things. We can't escape the way we feel. Anyway, Tekem, thank you so very, very much. Thank you so very much for this conversation. I truly appreciated it. I enjoyed it. Thank you.
It's my pleasure. It's my pleasure. It was nice being with you.